and welcome to the first episode of Ray's Anatomy. I'm your host, Dr.Sara Ray, here with a video message from our friend Benjamin, who after a recent trip to Mexico City thinks that he may have come down with the swine flu.
Yo Doc, I just went to Mexico for a vacation with my wife, and I'm experiencing some weird symptoms that I think might be swine flu.
Well Ben, I'm glad that you asked. This influenza generally affects swine, or pigs. However, it has the ability to jump to other species and affect humans as well. This is nothing new. We have seen it affecting people as early as the 1918-1919 pandemic, and now in the 2009 pandemic. Right now, it is at a stage 6, which means that a global pandemic is underway.
Yo Doc, I heard that the bird flu and the human flu is mixed in with the swine flu. Is that true?
Yes, this is true. Although this influenza's genes mainly come from the swine influenza, it also has traces of the molecular structure of the avian or bird flu and the human flu.
How can you tell if someone has the swine flu and just the regular flu? Is there any way to tell the difference?
Well Ben, if a patient is displaying flu-like symptoms, we will test them for influenza type A or B. Anybody with the swine flu will test positive for A. Then we'll do the subtype testing of H1N1. The H stands for hemagglutinin and the N stands for neuraminidase. This is basically just the way the virus enters and exits the host cells.
Hey Doc, can I get swine flu from eating pork or bacon or something like that?
No. Any pork products is absolutely okay as long as it's cooked. You have no chance of getting the swine flu from any pork products that is cooked. The way that the swine flu is transmitted is from respiratory secretions such as coughing or sneezing. And when a person who has the swine flu coughs or sneezes into their hand and then touches a fomite.
Whoa, hold it Doc, what's a fomite?
Well Ben, the virus has evolved to trigger its host to sneeze and cough. Thus, the virus is spread through respiratory secretions. Whenever this sick person coughs or sneezes into their hand, they then may touch a fomite. A fomite is an inanimate object with the ability to hold an infectious organism. When a healthy person touches these infectious organisms, they may touch their eyes, nose, or mouth, thus making its way down into their respiratory system.
How long can you get other people sick when you have the swine flu?
From the time that you get the germs into your body to the time that you display symptoms is called the incubation period. While we don't really know what the incubation period for this particular flu is, we're guessing that it is between 1 to 4 days.
So what are the typical swine flu symptoms?
Well, basically, the most common symptoms of the swine flu are fever greater than 100.4 degrees Fahrenheit, a cough, sore throat, runny nose, nasal congestion, aches, fatigue. And it should be noted that in some patients, the gastrointestinal symptoms were present in the clinical picture. However, in younger patients, such as children and infants, they can go through the entire flu without fever or coughing, or the fever and cough may be present. Other symptoms may include lethargy, apnea, dyspnea, which means shortness of breath, tachypnea, which means fast respiratory rate, altered mental state, or extreme irritability. Basically, you late at night.
So what are the complications involved with swine flu? Like, can you die from having swine flu?
Saying complications can mean a variety of things. Pneumonia with influenza is one of them and is a severe complication with the flu and can lead to respiratory failure and death. You've probably heard about bacterial pneumonia, but pneumonia can also be viral, and when the virus actually infects the alveoli in the lungs, it is called pneumonitis. This can result in death if it isn't cured during treatment. There's also complications with pregnancy, such as spontaneous abortion and preterm labor. Swine flu can also cause an exacerbation of any underlying medical chronic condition, and you can have a kind of upper respiratory tract disease, such as sinusitis or otitis media, with other pathogens on top of the flu. You can also develop lower respiratory disease with pathogens such as bacterial pneumonia, which can lead to respiratory compromise and death. Of the bacteria that infect patients with the influenza, Staph aureus tends to be the most talked about. Unfortunately, MRSA, which is a methicillin-resistant Staph aureus bacteria, can do this too. So you can get MRSA pneumonia post-flu. There are also cardiac manifestations such as endocarditis and pericarditis, and neurological complications such as toxic shock syndrome and febrile seizures.
Ooh, really? Who's at risk of dying from swine flu?
Sick people, those with extremes of age, such as young and old, chronic medical condition people with chronic medical conditions generally die with the seasonal flu. So we could deduce that it'll probably be the same with the swine flu. However, some scientists have said that they've compared it to the 1918-1919 epidemic, and that the 25 to 40-year-old people that were healthy were having such vigorous immune responses that they were releasing cytokines, which is your body's chemical messengers for the immune system. And so many of them were creating what's called a cytokine storm, which is a system-wide inflammation and has inability to sustain cardiorespiratory function. And currently in Mexico, it is showing that more people are succumbing to the virus when they're the healthier bracket, but we'll have to wait for more cases to have more data.
How do you test for swine flu?
Well, we won't be collecting samples with a wooden stick with a cotton tip. We will be using our nasal pharyngeal swab with a synthetic polyester tip. And the test that we're going to use is a real-time reverse transcriptase PCR, which basically amplifies the genes of the virus in the sample so that we can tell if you have it or not.
What's a probable, suspected, and confirmed case of swine flu? Like, what's the difference?
Well, in a confirmed case, it's an acute febrile respiratory illness with a fever, like I said, 100.4 degrees or Fahrenheit or above, and at least one of the following symptoms: runny nose, nasal congestion, sore throat, or cough. Now, a probable case means an acute febrile respiratory illness with a positive type A and a not yet confirmed RT-PCR. Now, suspected cases are a little bit harder to explain. It's basically an acute febrile respiratory illness, and at least one of the three things apply. One, they've had contact with a known case of swine flu in the past week. Or two, they've traveled to a hot zone in the last week, which is where there's lots of cases. Or three, they live in a hot zone.
Thanks, Doc. I'm going to go to my doctor now and see if I actually have swine flu.
Alright, well that does it for today's show. I'm Dr. Ray signing off, and if you have any further medical questions, please post them in the comments below. Thank you.